One of the things that that we got feedback from after the first documentary last year, we want more of Dr. Keneally.
Yes.
Tell her to. We want to hear her talk some more because you were very popular. So,
oh, good.
Thanks for this interview. One of the things they wanted to hear more about was the GC-MAF. So could you address GC-MAF real briefly? And they've had some challenges with the GC-MAF in Europe, if I heard correctly.
Yes, right.
Okay.
Okay. So one of the key things in health is optimization of the immune system, and I think it was 1999. A doctor or several doctors, there's actually conflicting information about really who discovered it, but that's not my deal. But anyway, there's something called GC-MAF, macrophage activating factor. What are macrophages? Macrophages are the Pac-Man of your immune system. And so we have to have a good immune system, whether you have cancer, heart disease, diabetes, dementia. We need a good immune system to take care of ourselves. And so when we make bad cells, cancer cells or viruses, they make an enzyme called nagalase. Nagalase poisons the macrophages, inhibiting them attacking the bad cells. Now, what you can actually do is you can actually measure nagalase. It's not done in the United States. It's done in a laboratory in the Netherlands. So we send our patients' blood to the Netherlands to see what their nagalase is. Now, most people we know who have cancer or viruses, we know they probably have high nagalase. Now, by the way, though, GC-MAF is used everything from autism to Alzheimer's to heart disease to cancer to chronic viral and bugs and infections. So we started utilizing it about 2 years ago, GC-MAF. It was offered in a company in Belgium in injections, and then they made an advanced version of GC-MAF called Geolaic, and now there's been lots of different influences on the European company, on the laboratory, and I'm not really sure what the details are. We've heard some of the details, but we have a relationship with a gentleman in Italy, and he worked with GC-MAF and Geolaic. He actually was here. He's actually a doctor who has done tons and tons of research with GC-MAF. And so now you can actually make GC-MAF in a probiotic. And you can actually make it in a yogurt yourself. You have to buy the starter material and make the yogurt yourself that produces GC-MAF. You can't just buy yogurt, organic yogurt on the shelves at your local store. You've got to get the starter material, and you can make your own GC-MAF in a yogurt, or what we use is a probiotic suppository called Bravo Probiotic. Now, I know it works because every single patient that I've used it on, their nagalase levels have decreased. So we know that an optimal level are somewhere between 0.3 and 0.9, and we try to get our patients to 0.6. And even if they get around 0.9, I'll tell them, look, okay, it's time to get off. Your body is now taking care of itself. So let's see how it does, how you do, and then I'll check your level in a couple of months.
So the way that the GC-MAF works is it targets the nagalase?
Yes.
Okay.
So so that your body now it interferes with the nagalase, so your body will
activate the macrophages.
Exactly.
Okay.
And attack.
That makes sense.
It's all now about your immune system. Your immune system has to be in the right order and the right functionality for you to take care of these chronic illnesses. Rheumatoid, arthritis, cancer, everything is related to your immune system. So now people are going, oh, okay, all these other things aren't quite working like we'd like them to. And so we have to, now employ and really get our immune system, because we know after 40, you start having something called immune senescence. What does that mean? An old immune system. And so we've got to now activate our immune system. I read a book that was written about 60, 80 years ago by a doctor, and it says, the book was called Your Body is Your Best Doctor. And in the book, he says, we enter geriatrics at 40, which I tell my patients, you have a warranty until you're 40, and then from 40 on, you've got to take care of your body. So anyway.
Where might somebody get a hold of the GC-MAF that you could culture in yogurt?
You can, if you go to the website gcmaf.eu, you can order it from them.
And is there, I mean, you may not know this, instructions on how to do that?
Oh yeah, they have very explicit instructions.
Okay, very good.
But all my patients, for the most part, relate very positive, and we see positive changes in their systems, and we see it working. I tell people there's not one magic bullet, because people say, oh, Dr. Healy, what do you think about this, and what do you think about this? I said, they all have value. I said, but we got to figure out what is best for you at this particular time, because the person you are in a month is not the person you are today. You've changed.
Hi, this is Ty Bollinger. Thanks for watching. If you want to know the truth about cancer, click the link in the description below to watch our award-winning docuseries, The Truth About Cancer, A Global Quest.